I'm Sarah Hamilton, Senior Programs Communications Manager at SmileTrain. Thank you all for joining us today to discuss a topic that is incredibly important to the cleft community: passage of the Ensuring Lasting Smiles Act, or ELSA. For those of you who are not already familiar, right now, whether a child in the US with a cleft receives the health care they desperately need at the time their doctor recommends, or at all, depends entirely on which state they happen to live in. Thankfully, Congress is considering legislation right now that would solve this problem, but it needs our support to pass. The Ensuring Lasting Smiles Act is a bipartisan bill that would close these statewide gaps in coverage and mandate that insurance plans cover all necessary services related to diagnosing and treating birth differences, including clefts. I'm happy to introduce Becky Abbott, Director of Research and Treatment Advocacy at the National Foundation for Ectodermal Dysplasias, or NFED. NFED has been a leader in advocating for ELSA since it was first introduced, and we appreciate your joining us to share more about this legislation and how the cleft community can support it. Becky, thank you again, and the floor is yours.
Thank you, Sarah, and thank you for joining us for advocating for the Ensuring Lasting Smiles Act. I'm Becky Abbott from the National Foundation for Ectodermal Dysplasias. I'm the Director of Research and Treatment Advocacy and also the co-chair of our Family Advocacy Committee. Here's a picture of my husband, Tom, as well as our three sons, Lachlan, Ryder, and Aiden. Aiden is affected by X-linked hypohidrotic ectodermal dysplasia, which is a congenital anomaly that affects his teeth. He has many misshapen teeth and many missing teeth. We're located in Slinger, Wisconsin, and we started our advocacy journey after many years of struggling with insurance coverage. Aiden met with Senator Tammy Baldwin when he was 10 years old and inspired her to write and introduce the Ensuring Lasting Smiles Act. What is the Ensuring Lasting Smiles Act, or ELSA? The Ensuring Lasting Smiles Act, or H.R. 1916 in the U.S. House of Representatives, or S-754 in the U.S. Senate, will ensure that private group and individual health plans do not deny or delay medically necessary treatments of congenital anomalies. ELSA is federal legislation that was reintroduced on March 16, 2021, with strong bipartisan support in both the U.S. House and U.S. Senate. The foundation for ELSA is that it's broadly written based on the 50 state statutes that require insurers to offer coverages for the medically necessary repair of congenital anomalies. About 4% of children in the U.S. are born with congenital anomalies, including oral defects such as cleft lip and palate, hypodontia, or enamel defects. It also includes skeletal defects, vision defects such as congenital cataracts, as well as hearing defects. The bottom line is that any medically diagnosed congenital anomaly that requires medically necessary treatments would benefit from the passage of the Ensuring Lasting Smiles Act. And this is the exact reason why over 60 plus organizations are supporting and advocating for the Ensuring Lasting Smiles Act. ELSA's lead sponsors in Congress: Senator Tammy Baldwin of Wisconsin and Senator Joni Ernst of Iowa introduced the Ensuring Lasting Smiles Act in the U.S. Senate. Representative Anna Eshoo of California and Representative Drew Ferguson of Georgia introduced the Ensuring Lasting Smiles Act in the U.S. House of Representatives. ELSA in the 117th Congress. The 117th Congress starts at the beginning of 2021 and ends at the end of 2022. On January 3rd of 2021, the 117th Congress began. On March 16, 2021, ELSA was reintroduced in the U.S. Senate and U.S. House of Representatives with strong bipartisan support. Since reintroduction, our families and ELSA advocates have engaged with their U.S. congressional offices to request that these legislators sign on as co-sponsors of the Ensuring Lasting Smiles Act. This means that the clock is ticking before the end of the 117th Congress. If ELSA does not pass before the end of the 117th Congress, we will need to have the bill reintroduced again and we'll have to start over. This is why it's so important that advocates reach out to their legislators and ask them to co-sponsor and move ELSA forward in the 117th Congress so we can get ELSA passed. ELSA in the 117th Congress. The Ensuring Lasting Smiles Act was referred to 3 committees in the U.S. House of Representatives: the House Energy and Commerce Committee, the House Education and Labor Committee, and the House Ways and Means Committee. As of today, we have 301 co-sponsors in the U.S. House of Representatives, and we've also reached House supermajority. House supermajority means that 2/3 of House members have signed on to co-sponsor the Ensuring Lasting Smiles Act. As of right now, we are waiting on our bill leads to decide what path ELSA will take to move forward. Will ELSA go through normal committee actions, or will it be placed on the House consensus calendar, which would force floor action and possibly bypass committee if certain conditions are met? In the U.S. Senate, it was referred to one committee, which is the Health, Education, Labor, and Pensions Committee, also known as the HELP Committee. In the Senate, as of today, we currently have 40 senators who have co-sponsored ELSA. Advocating for ELSA. How can our legislators help? If your member is not a co-sponsor, please reach out to them and ask them to support and co-sponsor the Ensuring Lasting Smiles Act. If your legislator or member is already a co-sponsor, it's very important for you to keep building your relationship with your legislative offices and thank them for co-sponsoring the Ensuring Lasting Smiles Act. Continue to reach out to their office and ask them to reach out to their colleagues, other leadership, and if your member is a member of a committee, ask them to indicate their support in committee and ask them to prioritize ELSA's passage in the 117th Congress. How do you know if your federal legislators are co-sponsors? It's very easy to check. All you have to do is go to www.congress.gov and enter in either the House number, which is HR 1916, or the Senate number, which is S754, and a list of co-sponsors will populate. Your story is powerful. Legislators want to hear stories from the patient's perspective, and you are the best person to share your story. We have an opportunity to help change the lives of many individuals like us and our loved ones who live with congenital anomalies. Your story can help a legislator decide to support and co-sponsor ELSA. Senator Baldwin and Senator Ernst and many legislators have supported and co-sponsored ELSA because of only one individual or one family's advocacy. Each legislator is important, and we need as many legislators as possible to support and co-sponsor ELSA. If legislators don't hear from you, they won't know how important ELSA is to your family and your patients. Anyone can advocate, no experience necessary, and anyone can advocate at any age. Will you be the advocate who will make a difference in your state? What information do you need to share with your legislators? You need to be honest and speak from the heart. Our legislators need to know how hard it is living with a congenital anomaly and the struggles that you or your loved ones go through. If you don't have a congenital anomaly and you want to advocate for ELSA, explain why this legislation is important to you. Make sure that you share important information about the Ensuring Lasting Smiles Act and ask your legislators to co-sponsor. Let your legislators know that you are counting on their support and that only members of Congress can help move ELSA forward. Thank them for their time, let them know you will follow up with them, and that you will be a resource of information for them in the future. Ways to advocate for ELSA. Connecting with your legislators. There are many different ways that you can connect with your federal legislators. You can schedule a virtual meeting with their DC office. You can call their DC office and ask your legislator to co-sponsor the Ensuring Lasting Smiles Act. You can advocate on social media by using the hashtag Ensuring Lasting Smiles Act. You can check townhallproject.com for upcoming town halls and events in your area. You can attend these events and ask your legislators in person to support and co-sponsor ELSA. You can schedule an in-person meeting while your legislators are in district. You can also ask your family, friends, co-workers, advocates, and fellow students, basically anybody who's willing to advocate for ELSA, and share SmileTrain's easy-to-use web tool. Just enter your physical address, and the web tool will find your legislators for you. Advocate on social media. Advocating on social media is one of the easiest ways to raise awareness for ELSA and get the attention of your legislator. Offices have different variations of their names, so you need to check your representative, whether they have their name listed under representative as congressman or congresswoman, and also your senators. Make sure you use the hashtag Ensuring Lasting Smiles. Don't forget to tag your legislator and include a picture of yourself or the ELSA graphic. You can either create your own post as shown here, or you can reply to your legislator's post and tag them in the comment section. You need to ask your legislator to support and co-sponsor the Ensuring Lasting Smiles Act, and you need to be kind. Kindness matters. Remain persistent, polite, and positive, and ask family and friends to repost and like your post to create additional awareness. Do you have any questions? My email address is becky@nfed.org. I'm available anytime and would be happy to answer any questions you may have about the Ensuring Lasting Smiles Act or how you can advocate for the Ensuring Lasting Smiles Act. I want to thank you for your support in advocating for ELSA, and our voices are stronger together and can make a difference to get ELSA passed. Thank you for your time.
I'm sure the story Becky shared around her family resonated with many of you who have faced similar challenges with insurance denying or delaying coverage for medically necessary procedures. For children born with clefts and for their families, cleft treatment is often a journey that requires multiple stages of treatment spaced out over time, extending even into the teenage and adult years. Too often, medically necessary procedures aren't covered by insurance plans because they fall within an insurance gap or exception, or because they're dismissed as cosmetic. Depending on the state, this often includes dental care, orthodontic treatment and equipment, and prosthodontic care necessary to address malpositioned or misting teeth and jaw misalignment, all of which are very medically necessary procedures for children with clefts. The passage of ELSA would be a step towards addressing this imbalance and ensuring that children born with birth differences can access the care they need and that families aren't burdened with exorbitant out-of-pocket costs. Following the example that NFED has set with their advocacy, SmileTrain has been working to mobilize the U.S. cleft community to advocate and share their story in support of ELSA. As Becky mentioned, we have an easy-to-use web tool to help you advocate at smiletrain.org/advocacy. You can use this to find your representatives and reach out to them with a message, either thanking them for their support of ELSA or asking them to become a co-sponsor. In honor of CleftCon, we've also prepared an opportunity for you to advocate right now. If you visit smiletrain.org/advocacy, look for your representative, and use the social copy on the web page to reach out to your representative. We've also put that copy in the chat. If anyone would like to learn more about NFED and their advocacy work, please visit Becky's profile and visit our webpage to learn more about SmileTrain's work and reach out to your representatives. Thank you so much, Becky, and thank you so much, everyone, for joining us today.
Hi, sorry, getting my audio. Hi.
Hi, Sarah.
Thank you, Becky, and thank you everyone who's joining today and being so active in the chat. We're really excited to talk about this topic and share how you all can do more. So Becky, in the chat, someone asked, what can I do if my senator is already a supporter of ELSA? How can they still join in and advocate?
Yeah, so that's a great question. And the most important thing you can do is to continue to reach out to that office. My senator is a co-sponsor. However, she still needs to understand how important this legislation is to all of our families and all of our loved ones and advocates. So it's important to reach out, continue to reach out, share your story, ask your senator or your representative who signed on to make this legislation a priority, and have them reach out to their colleagues if they haven't co-sponsored, if there's another senator in your state who hasn't co-sponsored, and try to garner their support. If we don't continue to keep reaching out, then there'll be other legislation that will be more important. So we want to make sure that we keep awareness on this legislation at all times.
Great, that's a great point. And then for some of the audience who are interested in advocating to their legislators who aren't supporters, what can they expect if they schedule a meeting? What's the format of that like, and how should they be prepared?
So the easiest way to schedule a meeting would be to contact your legislator's Washington, D.C. office, which is very easy to find. All you have to do is search online for your legislator's name, and there will be a list of their offices. And like I said, the easiest way to go about that would be to contact their DC office. Once a meeting is scheduled, the meetings are very laid back. You usually meet with a member of their office staffer instead of the actual member themselves. And those staffers are just important as meeting with the member of Congress because they're the ones who are going to do all of the legwork and research the legislation to find out if the legislator should co-sponsor and support that legislation. You just need to be very honest and explain exactly why you're advocating for the Ensuring Lasting Smiles Act, briefly explain what the Ensuring Lasting Smiles Act will do, and then the most important tool that you have is your personal story. You need to explain exactly how this congenital anomaly is affecting you, the insurance struggles you're going through, how it has affected your family as well. The legislators won't know how important it is to help your family if you don't explain all of those things. Once the meeting is wrapped up, then it's just as important to contact them afterwards again to make sure that you follow up and let them know that you're counting on their support and that you'll be a resource in the future for any information or questions they may have.
And we've been lucky enough to attend a few meetings with some of the Smile Train Cleft community members who have been advocating and just echoing all of that. The representatives really just wanted to hear from their constituents and understand their story and how this impacted them. So they were all wonderful meetings. Do you have any advice around how cleft community members can involve their family and friends in advocacy? I know you spoke to that a little bit in the presentation, but have you found anything personally to work the best in getting other people on board?
Yeah, I think the two most important things are one, share your story with your family and friends and explain why you're advocating. Sometimes your family and friends don't even know your personal story, even though you think they might know that because you're close to them. But take time to educate them about the Ensuring Lasting Smiles Act. Explain why you're advocating and how much it would mean to you to have them advocate as well. There are many different resources online that you're sharing in the chat, but have them join in on different advocacy initiatives. Today we're having an advocacy initiative trying to get the hashtag Ensuring Lasting Smiles trending on social media. So it can really just take a 30-second post online with the hashtag Ensuring Lasting Smiles to raise awareness and to get others involved. It really doesn't take much time at all. And then also with your awesome, easy to use web tool, you can email that to family members and friends and ask them to send a quick email to their legislators asking them to co-sponsor and sign on. So there's a variety of options, and those options only take a few minutes to go ahead with.
Great. And everyone, the hashtag that Becky just mentioned is in the social media copy that we've shared in the chat and on the site. So whenever you all get a chance today, if you want to go ahead and do it now, maybe, just share that and help get that hashtag trending. So I'm looking through the chat for additional questions. Tiffany Tyler asks, should we start a petition? Is that a good strategy for getting people involved and showing the enthusiasm around this?
Yeah, that's also a great question. And that's come up several times. We have reached out to our bill leads, and they did indicate that legislators want to hear personal stories from constituents. So they said that the most powerful tool, as I mentioned before, is to reach out to your legislators, share those stories, and make sure they understand that their constituents need help and how they can help. So it's really a grassroots movement from families and loved ones, and we need to keep that going.
Perfect. And Michelle asked, is there a sample letter we can use? I'll take that one really quickly, Michelle. There is. On Smile Trans Advocacy website, there's a tool where you can just look up your legislators and then auto send a message, and that will email them. And then, I mean, Becky, it goes without saying that you are incredible. You're an incredible advocate, and the work you're doing is amazing. What personally inspired you to kind of take that next step and begin meeting with representatives and advocating on this huge scale?
Yeah, I kind of briefly touched upon it in my presentation, but my son Aiden has a form of ectodermal dysplasias, and he's missing many of his teeth. We have gone in circles with our health insurance to try to get coverage. At some point, our insurance told us that they would not cover most of his treatments that were needed, and the treatments, of course, are medically necessary. They affected his speech, swallowing. So many different secondary issues arose from them. And when we couldn't get any help in our state, my family decided to pack up and drive the kids out to Washington, D.C. We thought it was our last ditch effort and that hopefully somebody would listen to us. As a blessing, Senator Baldwin listened to Aiden and decided that she would like to help, and then went on to introduce the Ensuring Lasting Smiles Act. And the reason I bring that up is because there are so many legislators, Senator Ernst, Congresswoman Eshoo, Congressman Ferguson, our bill lead, so many of our co-sponsors who have heard from one of their constituents. They didn't know that these issues were arising in the community. They didn't know that children were born without teeth, or children were having issues getting medically necessary treatments covered. And each one of those families were able to garner the support of their legislator. And then from that point on, they co-sponsored and then also reached out to other offices to try to garner support from other legislators. So I just want to really reiterate that anybody who's listening to this, it doesn't matter what age you are, as long as you're willing to share your story and be brave, that you can really make a difference for not only the cleft community, but so many other congenital anomalies who face the same issues that we're having. So just always keep in the back of your mind that this is much bigger than ectodermal dysplasias or the cleft community, that there's so many other families who can benefit from this legislation. And that's why it's so important to get this passed.
Thank you. I'm literally getting goosebumps just from hearing you speak about that. But yeah, completely agree. Advocacy can bring together so many different communities to create change, and it just really takes one person at the start of it. So I'm looking one more time through the chat to see if there are any new questions that have popped up. Megan says that she isn't sure how to see who has already signed on to support the bill. Should we prioritize those who are already involved or not involved yet?
Sure. So all you have to do is go to www.congress.gov and then type in either the House bill number, which is HR 1916, or the Senate bill number, which is S754. It'll pop up with a list of co-sponsors. So right now the House is at 303 co-sponsors, and then in the Senate it'll be 40 co-sponsors. I would prioritize the legislators, number one, who have not co-sponsored ELSA, because we want to garner their support and get them on board. However, it's also just as important if you have a member of Congress who has already co-sponsored, if they're a member of a committee that ELSA has been referred to, we need their help in order to move ELSA forward in the 117th Congress, and they're the ones that can do that. So, for example, my senator's on the HELP committee, so I would reach out to her and just indicate, you're on the HELP committee, we need your help to move ELSA forward. Can you please prioritize ELSA? This is why you should prioritize it. My son needs these medically necessary treatments. There's all of these different congenital anomalies who need medically necessary treatments. Let's get ELSA passed.
Thank you. And Adina has shared the web address that Becky mentioned in the chat. And Lucy has written 3 times to her representatives and is now planning to meet with them.
That's wonderful, Lucy. Thank you so much for your advocacy, your persistent advocacy. It's people like you who are moving this legislation forward by the stories you're sharing with them.
All right, so we have a little under 5 minutes left. I'm seeing if there's any last questions. Yes, we can add those bill numbers to the chat, Megan. We'll either do that shortly or follow up with it. All right, unless anyone has any last questions that they want to type in quickly. Becky, thank you so much for your time, sharing your expertise. Even before we met you personally, we were learning so much from NFED and the advocacy you've done. So thank you so much for just being a wonderful example of advocacy and action for the community.
Yeah, thank you for inviting me to speak today. I hope I inspired somebody to share their story. It may feel a little bit intimidating at first because you think of your members of Congress and you're not sure what to expect and how to set up a meeting. But like I said, anybody can do this. This bill has the opportunity to change so many people's lives. And we're a team effort. And like I said, it's all of us working together to make sure that all of our loved ones and advocates get the medically necessary treatment. So thank you so much. Thank you for your passion and prioritization of the Ensuring Lasting Smiles Act and for having me on today.
Thank you. And thank you, everyone. If you had a question that we didn't get to in the chat, we will follow up with you and make sure that we get you that information. So thank you, everyone. Bye.
Bye.